Ever wondered what happens during a medical assessment? In the world of healthcare, a medical assessment serves as a critical first step in understanding a patient's health situation. But what exactly is a medical assessment? Let's dissect this important process. At its core, a medical assessment is a systematic way to gather and analyze data about a patient. This involves a deep dive into the patient's health history, a detailed look at any symptoms they might be experiencing, and an objective evaluation of their physical condition. The information collected during this process forms the backbone of a diagnosis. Think of a medical assessment as a detective's investigation, where every clue contributes to the final conclusion. It's a comprehensive, meticulous, and crucially important process that helps doctors identify what's going on inside a patient's body and ultimately guide them towards the right path of treatment. In the next few minutes, we'll delve into the step-by-step process of a medical assessment. Now, why is a medical assessment necessary? Well, let's dive into that. A medical assessment is the cornerstone of good healthcare. It's the first point of contact between a patient and their healthcare provider. It's like a detective's investigation, piecing together the clues to solve a health mystery. A comprehensive medical assessment helps determine a patient's current health condition. It's a snapshot of their health at a particular moment in time. It takes into account symptoms, medical history, lifestyle, and even emotional well-being. But it's not just about identifying what's wrong. It's also about creating a roadmap for treatment. A thorough medical assessment guides healthcare providers in crafting an appropriate treatment plan tailored to the patient's unique needs. It's the blueprint for a patient's journey towards recovery and wellness. So, the medical assessment is a crucial first step in any treatment. It's not just a formality, it's a vital tool in the quest for health and well-being. The first step in a medical assessment involves taking the patient's history. In the world of medicine, there's a saying that goes, "The history is half the diagnosis." This underlines the crucial role of understanding a patient's history in diagnosing medical conditions. The process of gathering a patient's history is not just a casual chat. It's a targeted, systematic conversation designed to uncover the full spectrum of information that can aid in the diagnostic process. The process starts with understanding the patient's personal history. This includes their lifestyle habits such as diet, exercise, sleep patterns, and smoking or alcohol use. It also takes into account any previous illnesses, surgeries, or allergies. Even seemingly mundane details like their occupation or travel history can sometimes hold the key to identifying the root cause of their symptoms. Next, we delve into the patient's family history. The importance of this step cannot be overstated. Many conditions have a genetic component, and knowing that a patient's parent or sibling has a particular disease can sometimes point us in the right direction. For instance, a family history of heart disease or certain types of cancer can significantly influence a patient's risk profile. Then, we turn our focus to the history of the present illness. This involves understanding the onset, duration, and progression of the patient's symptoms. We'll need to know what makes the symptoms better or worse, and if they're associated with any other signs or symptoms. However, gathering the patient's history isn't just about collecting facts. It's also about building rapport and trust. It's about showing empathy and understanding, which can encourage the patient to share more details, perhaps even those they initially deemed insignificant. In summary, taking a patient's history is a complex process that requires meticulous attention to detail, excellent communication skills, and a genuine interest in the person sitting across from you. It's not simply a box-ticking exercise, but a fundamental part of medical assessments that sets the stage for the rest of the diagnostic process. A comprehensive history can provide crucial clues to a patient's diagnosis. After gathering the history, the next step is the physical examination. Now, the physical examination is a step-by-step process that involves 4 key components: inspection, palpation, percussion, and auscultation. Each of these steps plays a crucial role in the examination. Let's start with inspection. This is all about using our eyes. Doctors look for any visible signs that could be indicative of an underlying health problem, such as skin color changes, abnormal movements, or unusual growths. It's a testament to the old adage, "A picture is worth 1,000 words." Next, we move to palpation. This step involves the doctor using their hands to feel the body. They're checking for things like lumps, tenderness, warmth, or swelling. It's a hands-on approach that can often reveal issues that aren't immediately visible to the naked eye. Percussion comes after palpation. In this step, doctors tap on specific areas of the body to produce sounds. These sounds can provide valuable information about the underlying structures. For instance, a hollow sound could indicate the presence of gas, while a dull sound might suggest a solid mass. Lastly, we have auscultation. This is where the doctor listens to the sounds your body makes, usually with the aid of a stethoscope. They listen to your heart, lungs, and other organs. The sounds, or lack thereof, can give the doctor clues about your health. Each step in the physical examination process provides a piece of the puzzle. Inspection gives us a visual overview. Palpation allows us to feel what might be hidden. Percussion lets us hear what's beneath the surface. And auscultation brings the internal sounds to our ears. Together, these steps allow doctors to gather vital information about a patient's health. They can identify symptoms, detect abnormalities, and start to form a picture of what might be going on inside the body. So you see, the physical examination isn't just a routine procedure, it's a crucial part of the medical assessment, a science and an art that combines observation, touch, sound, and professional knowledge to understand a patient's health. A careful physical examination can reveal a wealth of information about a patient's health condition. Once the physical examination is done, it's time for diagnostic tests. These tests play a critical role in the medical assessment process, providing tangible data that can help confirm or refute a suspected diagnosis. Let's start with blood tests. These are commonly used to check for signs of disease in your body. They can identify abnormalities in your blood cells, detect infections, and even measure the levels of certain substances, like glucose or cholesterol. Blood tests can also help monitor the function of your organs, such as your liver or kidneys. A simple blood draw can tell a doctor so much about what's happening inside your body. Next, we have imaging studies. These tests create pictures of the inside of your body, allowing doctors to see what's going on beneath the skin. X-rays, MRIs, kinetic scans, and ultrasounds are all forms of imaging studies. For example, an X-ray can show if you have a broken bone, while a CT scan can reveal details about your organs, blood vessels, and bones. An MRI provides detailed images of soft tissues, and an ultrasound uses sound waves to create pictures of organs and structures inside the body. Then there are specialized tests. These are used when doctors need more specific information about a particular part of your body or a particular condition. For instance, an endoscopy allows a doctor to look inside your digestive tract, while a biopsy can help diagnose cancer by examining a small sample of tissue under a microscope. Each of these tests plays a different role in the diagnostic process, but they all share a common goal: to provide clear, concrete evidence that can help a doctor confirm or rule out a diagnosis. They are an essential tool in piecing together the medical puzzle that is your health. Diagnostic tests provide concrete data to support or refute the suspected diagnosis. They turn the intangible, symptoms and signs, into something tangible, something that can be measured and analyzed. And that's why they're such an important part of the medical assessment process. After all these steps, we arrive at the diagnosis. Now that we've gathered a wealth of information from the patient's history, physical examination, and diagnostic tests, it's time to piece everything together. Think of this process as a puzzle. Each piece of information is a puzzle piece, and we're trying to form a coherent picture. Making a diagnosis is a critical part of the medical assessment process. It's not just about labeling the problem, but about understanding the root cause behind the symptoms. The diagnosis provides a roadmap that guides us in making informed decisions about the most effective treatment options. The process of making a diagnosis involves careful analysis and consideration of all available information. It's a task that requires both scientific knowledge and clinical judgment. The clinician must not only understand the disease processes but also appreciate the unique context of each patient. Think of it this way: two patients may have the same condition, but their diagnoses could be different based on their individual histories, physical examinations, and test results. A diagnosis isn't a one-size-fits-all label. It's a personalized understanding of what's happening in a person's body. This is why it's so important to consider all the information collected during the medical assessment. The patient's history might reveal risk factors or previous conditions that influence the diagnosis. The physical examination might uncover signs that point towards a specific disease. The diagnostic tests could provide objective evidence that confirms or refutes our initial hypotheses. Of course, making a diagnosis isn't always straightforward. Sometimes the information we gather is ambiguous or conflicting. In such cases, we may need to seek additional tests, consult with colleagues, or revisit the patient's history and physical examination. But despite these challenges, the goal remains clear: to arrive at the most accurate diagnosis possible. Because a correct diagnosis isn't just about naming the problem, it's about understanding the problem so that we can choose the most effective treatment. In the end, a correct diagnosis is the key to effective treatment. It's the compass that guides us in our journey towards helping our patients regain their health and well-being. The final step in a medical assessment is forming a treatment plan. This is a crucial part of the healthcare journey as it maps out the course of action to manage or cure the patient's condition. Let's delve into how a healthcare provider creates this plan. Once a diagnosis has been made, the treatment plan is formulated based on several important factors. The first of these is the patient's overall health. The healthcare provider must consider the patient's physical condition, underlying health issues, and their body's ability to respond to treatment. For instance, a treatment plan for a person with a robust immune system might be different from someone with a weakened one. Next, we have the patient's age. Age can significantly influence the treatment plan, especially in cases of chronic diseases. Children, adults, and the elderly may all require different approaches to treatment. For example, the elderly might need a more cautious approach due to their generally lower physiological reserves. Another significant factor is the patient's personal preferences. The healthcare provider should take into account the patient's comfort levels, personal beliefs, and lifestyle. For instance, some patients might prefer non-invasive treatments or therapies that align with their personal or religious beliefs. A treatment plan is not one size fits all, and it needs to be tailored to the individual needs and preferences of each patient. Lastly, the healthcare provider also considers the potential side effects and risks of the treatment. They aim to choose a treatment that brings the most benefit with the least harm. This is where the concept of risk-benefit analysis comes into play. The healthcare provider must weigh the potential benefits of a treatment against its potential risks and side effects. In conclusion, creating a treatment plan is a complex process that requires a holistic view of the patient's condition and individual circumstances. It's not just about curing the disease, but also about improving the patient's quality of life and ensuring their well-being. A well-thought-out treatment plan is vital in managing a patient's condition. Let's quickly recap the medical assessment process. We began our journey by understanding the core concept of medical assessment. It's a systematic approach, a fundamental process in healthcare that enables us to identify and diagnose a patient's condition. The importance of medical assessment cannot be overstated. It's the foundation upon which every treatment plan is built. We dove into the first step of this process, taking the patient's history. This step involves meticulously gathering information about the patient's symptoms, medical history, lifestyle, and even family health history. It's like being a detective, piecing together the puzzle of the patient's health. Next, we moved on to the physical examination, a hands-on approach where healthcare professionals use their senses and medical tools to assess the patient's body. This step adds another layer of understanding to the puzzle, confirming or refuting our suspicions from the history-taking stage. Then, we ventured into the world of diagnostic tests. These can range from blood tests to imaging procedures like X-rays and MRIs. These tests offer us a more in-depth look into the patient's body, often revealing what our eyes cannot see and confirming or challenging our preliminary diagnosis. With all this information at hand, we arrived at the diagnosis stage. This is where the pieces of the puzzle come together. The diagnosis is the culmination of all the previous steps, where we identify the condition or disease affecting the patient. Post-diagnosis, we charted out the treatment plan. This is a tailored approach, specially designed to manage or cure the patient's condition. This plan can include medication, therapy, lifestyle changes, or even surgery depending on the diagnosis. So, there we have it. From history-taking to treatment planning, medical assessment is a journey of detective work, exploration, and strategy. It's a complex yet fascinating process that underlines the importance of every step and every detail. Remember, a comprehensive medical assessment is the cornerstone of effective healthcare. We've covered a lot of ground today. From understanding the importance of a medical assessment to diving deep into each step involved, it's clear that this process is a crucial part of healthcare. We've walked through the patient's history, physical examination, diagnostic tests, diagnosis, and finally, the treatment plan. Each step is a piece of the puzzle that, when put together, provides a comprehensive view of a patient's health. This intricate process is not just about identifying an illness, but also about understanding the patient's overall well-being. It's about putting patients at the center of care and making informed decisions to enhance their quality of life. For those of you with a spark of interest in the medical field, I encourage you to delve deeper into this realm. The world of medical assessments is vast and constantly evolving, offering a plethora of opportunities to learn and grow. Remember, the journey to health begins with a thorough medical assessment. Thanks for tuning in.